Now, we're making this video because there are, hopefully it's going to clear up a number of issue with the upper eyelid tightening. Because we've seen it a number of times and it seems to be the same problem over and over again. Now, for upper eyelid tightening and lower eyelid tightening, after these treatments, the healing is extremely good. Why do we say, if in doubt, use nothing? It's because the very few bad healing, prolonged healing, or delayed healings, redness, excessive swelling over a long period of, well, relatively long period of time, is normally due to the use of products. Now, if you're using products, you've got to use something that is sterile and appropriate for the sort of burn that we are inflicting on the upper or lower eyelids. That's a given. Even if the product is appropriate, there is no guarantee there is not going to be an allergic reaction to it. And if the person is allergic to any of the several ingredients that are in these products, swelling, redness can appear. Now, so the reason why we're saying, if in doubt, use absolutely nothing, is because it is, whenever there's been very seldom some complications, and we said, don't use anything. If you want to do something, just wash it with very mild soap and that's it. Everything went back to normal. And this happens in only a very small percentage of the cases, in the region of, say, 1% of the treatments for upper and lower eyelids, eyelid tightenings. Now, we're going to show you two examples in this video which are quite good. So this is Isabel, which I've treated myself, and this is a picture that came in a week after the treatment. Look, if I remember well, I've done only the upper eyelids. I can't remember, but we've taken the video. Look at these, the swelling here, look at the swelling there, redness, and this is after a week and swelling. After a week, there's something definitely going wrong. No, absolutely not. This is not right. So basically, what we said is stop using any possible thing you can stop. Just stop using any products. Just stop it immediately, whatever products you're using. And I think it was a day after. Let's see whether I can go back and find the pictures. A day after, we have. Have a look. Oh, there we are. I think it's a day after or 2 days later, zero. I mean, the swelling seemed to have gone, and so is the redness. So just that change of saying use nothing, forget it, don't use anything, zero. That's it. Very likely in that case there was either the inappropriate product or an allergic reaction to something. So I'm not just stopping using anything resolve the problem. Now let's go to the next one, which is actually the reason why we're making this video, because we've got something similar today. I was doing a few things, so please Andreas, stop doing anything and look at this. So apparently this was a treatment done on Friday. Today is Tuesday, and this is the way apparently today the person is this is how her eyes look like today. Very likely it was upper eyelid tightening, very likely, and this is not right, absolutely not right, especially because now going back to the healing progression, which you can actually study on voltaiplasma.com. The healing progression works this way, roughly. First day after treatment, if you get swelling, not everyone gets swelling. If you get swelling, it's going to be tops the first day. after treatment. And then the second day starts to subside slightly. The first day you've got top swelling and also top pain, so to speak. The maximum pain is the first day after treatment, the first night and the first day after treatment, and then it starts to subside over the first day, over the afternoon towards the evening. So after 24 hours, the pain, if there's any, is going to subside slightly. Second day, less swelling. The pain is almost gone in most of the cases. Third day, almost no swelling and maybe a little bit, but it's just on its way to be gone. Sometimes you find on the lower eyelids, even if you haven't touched them. We have case studies and the information about that on voltaicplasma.com. But basically, the third day, there should either be very little swelling, there shouldn't be any pain, there shouldn't be any discomfort. This is a case that falls out of this normal trend, and very likely is the use of some products that have caused an allergic reaction, and maybe too aggressive, or the wrong products, may not be sterile. There's many factors. This is once again why we're saying, if in doubt, use absolutely nothing. Because in all cases so far, when people have used nothing, the healing went particularly well, really well, and it was quite according to plan. So, as a rule of thumb, if you're always monitor your clients, get pictures coming in daily. The reason is if something goes wrong, because you should have the experience of the healing progression already. If you don't have it, we got that experience for you on voltaicplasma.com, so go get it free of charge. Before you buy anything, before you use them, we give you this experience free of charge, so you actually see how these areas heal, and then normally after there's no use of any products, this should actually go away. Now, there is a reason for it. It's not just because we are the experts or anything. From a logical point of view, and not only because we have lots of experience, we've seen it over and over again, but also look at it from a logical perspective. What we're doing, we're burning the skin. So a classical way of a burn to resolve is within a few days. So, and the burn peaks the first day after the burn has occurred, and then it starts to subside. If this is not the trend, there's something wrong, and there's either an infection in upper eyelid tightening. We haven't seen any infection so far, but most likely it's the use of products. Even the Dettol that we recommend is not a given that you're using the right one, because we recommend Dettol, a brand name, because it's got benzalkonium chloride, but not all Dettol are meant to be used on the skin. And even if you dilute it, you may not dilute it to the right concentrations of benzalkonium chloride. Maybe the Dettol that you're using has got other active ingredients which are not suitable for it. So the Dettol we suggest is for skin care only, and it shouldn't be diluted. On voltaicplasma.com, we actually put down the right concentration of benzalkonium chloride. The problem with benzalkonium chloride, although it's really good for it and is used in eye drops as well sometimes, it's got to be in low concentrations, because if it's too high concentrations, it becomes a source of irritation to the skin, especially a skin that has been dealt with by plasma, arcing lasers and so on, which is very delicate. So if something goes astray, stop using any products. And Dettol, if you want to use it, the reason for us to recommend it is because it's a worldwide product and is available pretty much in most countries in the Western world and even in Asia. But not all countries have got the right one, and sometimes they ask you to dilute it. If they ask you to dilute it, maybe they have different active ingredients, and certainly the benzalkonium chloride, which is what we're looking for, maybe too high concentration or too low concentration. If you dilute it incorrectly, you can cause problems. So if you're not sure, use just normal mild soap. And you can use certain products, some soothing products, which are made on purpose for these sort of treatments, for laser treatments and plasma treatments. We've got the Bay Cream, which so far hasn't caused any issues, any allergic reactions. But if something of the sort happens, the first thing to do, stop the use of any topical products. That's number one. Also, if people go to the doctors, I'm not saying they shouldn't go, I say they should, but the problem is the doctors don't really know what's going on. And sometimes they prescribe medications which are not appropriate. So I'm not saying don't ask your clients not to go to the doctor, but from experience, sometimes they get prescribed the wrong thing. So the first line of action, the course of action is, number one, make sure that you've got an aftercare protocol that you provide. If you're not sure, you can use our aftercare protocol on our website, is voltaicplasma.com. Everything is automated. The client receives an email with the aftercare instructions. Make sure that your client sends you their pictures daily up until the area is completely healed. And should there be any problem, very likely is due to the use of creams, makeup, etc. Mind you, don't be naive. Sometimes they even don't tell the truth, because what they say, they haven't used anything, or that is different than what you're saying, or anything at all, and then you later on, as it happened, then they actually confess to have used something. That is something to bear in mind. Hopefully this video is making life a bit easier, and should you have any questions, by all means, we're here to try and help you with this type of treatments.